Oh, they're all interested in healthcare, it's just different
Great.
forms. So.
Okay, so what kind of healthcare are you guys interested in? Who's interested in nursing? Anybody into it? Who's interested in being a physician? So what other kind of healthcare are you interested in?
Well, I kind of want to be a neurologist.
Okay,
I want to be a neonatologist.
okay,
I want to work with kids, so like pediatrician.
Okay.
Yeah, that's what I was going to say, pediatrician.
anything else over here?
I want to be an L&D nurse.
Yeah, that's very exciting. That is, has a lot of highs, and the lows are very, very low. So, yeah.
Maybe a nurse practitioner.
Okay, those are all really good. I'm a nurse. I didn't start off right after high school as a nurse. I started off in accounting, and then as an adult decided to change career paths. So, you know, a lot of studies say now that people have 3 careers in their lives. Healthcare is a really good career. It's really versatile. There's a lot of things you can do with it. There's a lot of different ways to enter the healthcare field. You can go and get a 4-year degree in biology or chemistry or something like that. You can take that into pharmacy school. You can take that into become a physician. I heard neonatologist and yeah, so those are all different. You become a physician, and then you can specialize in medical school into cardiology, into neonatology, into oncology. There are a lot of different ways to specialize. That's a lot of schooling, but it is very, very rewarding, very fulfilling career, a lot of hours. The one thing I'll tell you about healthcare is you have to love what you're doing, because it's a lot of hours, it's a lot of crazy hours. There are some healthcare jobs that are 9 to 5. I would say the majority of them are not. People get sick all hours of the day and night. They get sick on weekends. They get sick on holidays. So I work as a nurse in a cardiac cath lab. So I work in cardiology. I've also worked in the emergency room at Allen and at Covenant. And I worked on an inpatient cardiac floor. So right now in the cardiac cath lab, when my pager goes off, I have 20 minutes to get to the hospital. So that's what my career looks like for me. When I have days that I'm on call or weekends that I'm on call, I don't, like if we go somewhere with my family, we drive separate so that I can get to the hospital when I'm needed. A lot of nursing careers, people work 12-hour shifts. A lot of physician careers, you're working 12-hour shifts, you work nights. So it is amazing, it is rewarding. You save lives and you help people. And that is amazing, but you do it at all hours of the day and night. And so some people don't care for that sort of hours, that sort of, it's kind of a lifestyle. And some people, like me, the rewards are just, they're worth it. It's really, really worth it to help somebody get better or help somebody at the end of their life. You know, that's part of it too. People don't always get better. So you have to be able to, you have to know that. You have to be able to deal with that. It's a big part of the job. And it's just as important to help somebody at the end of their life as it is to help somebody get better. What kind of questions do you guys have? Who are my nurses here? Who are interested in that field? There's a few ways to enter the nursing field. You can enter as an LPN, a licensed practical nurse, and I'll tell you what they are here in Iowa. Some places they're called a licensed vocational nurse. That's a 1-year degree. It's a diploma program. You can enter as an ADN, which is an associate degree nurse. That's a 2-year degree. The 2-year degree nurse and the 4-year degree nurse are both called RNs. That's a registered nurse. So there's 2 different ways of entering that career path. One is a 4-year degree that has everything that comes along with a 4-year degree. You get management classes, you get history, you get writing classes. It's a little more rounded degree. But those RNs all sit for the same board examination. So I got my 2-year degree, and then when my youngest son went to kindergarten, I went back and did online and graduated summa cum laude, and I'm really proud of that with my 4-year degree. So I have a bachelor's degree in nursing. I've been a nurse for a little over 5 years, and it's pretty amazing. There's a lot of things you can do with it. You can work for insurance companies, you can work for hospitals, you can work for long-term health care facilities, you can work for a doctor's office. So a lot of different things, and then you can become a nurse practitioner. Who wanted to do that? That's a master's degree. Different programs have different requirements, but a lot of them require you to have a couple of years of nursing experience, and then you get your nurse practitioner. And that allows you, different states have different rules for nurse practitioners. In Iowa, a nurse practitioner can write prescriptions for medications and treat patients without the supervision of a physician. In other states, you have to have a supervising physician. So there are different rules for healthcare from state to state. So it's important to know where you want to practice before you start down your career path so you can make sure you get everything you need to. Who has a question?
What are some of the classes that you had to take?
Some of the classes I had to take, very good question. Chemistry, anatomy and physiology, and I had the option to take a couple different versions of anatomy and physiology, and I chose the most difficult one because I can't imagine not having it. I could go on about how your kidneys work and how they interact with the chemicals in your brain and how it's just understanding all of the body systems and how they work together. Chemistry, of course, because you need to understand chemistry. Pharmacology, to learn about medications and different classes of medications. We take writing classes because to be a professional, you have to know how to communicate with the written word. It's really important. I can't tell you enough, if you send an email and it's just written poorly, people don't think as highly of you as they might. So being able to write is very important in any field you go into, but in healthcare. You know, we took history classes, we took management classes. I mean, some of those classes in that four-year degree are kind of the basic stuff. You call them gen ed classes. A lot of science classes, a lot of hands-on clinical classes, and this is true for doctors and nurses. You are in a class and you go in as a student group and you are assigned a patient and you act as though you're their nurse. With supervision, of course, you pass meds, and with physicians, they go in and they act like they're the ones who are going to treat that patient, and you do everything you would normally do alongside a professional, a licensed professional. And at the hospital, I've had clinical groups, and I've had students who have followed me, and I kind of teach them. It's their senior internship at Allen College. They do, I think it's 150 hours. So they'll come and they'll pair up with a single nurse, and you teach them to take all of the bits of information that they've learned in all of their classes and kind of string it together into caring for 5 patients for a 12-hour shift. Yeah.
What can you do in like high school to prepare to go to college and get a job?
Well, if you're interested in the medical field, what I would urge you to do is get a job in a hospital somewhere and get some exposure to it. As far as classes you can take, science classes, any kind of anatomy class that you can take would be really good. I'd urge you to job shadow the profession that you think you might be interested in. And Allen Hospital has a job shadow program. I can leave you the name of the gal who runs that. And you can call up and say that you'd like to shadow, and you can shadow a physician for a day, or you can shadow a nurse for a day, or you can go in and get different experiences so you can. I love my job. It is not what I thought it would be. And that's okay. There are a lot of jobs that it's hard to know what you're really getting into. And like I said, the medical field is tough.
How did you know you wanted to be a nurse?
Oh, how did I know I wanted to be a nurse? When I was your age, I wanted to be a teacher and I wanted to be in the medical field. And I ended up in accounting for quite some time, almost 10 years, and then I stayed home with my kids for about 10 years. And just through life experience, I was still drawn to the medical field. And I had 3 kind of rough pregnancies and had quite a bit of exposure to the medical field. And it's just something I knew I wanted to do. But I'm not doing what I thought I would do. I thought I would do labor and delivery, and I thought I would do peds, which I still love. But when I graduated, there weren't any jobs in that. So a lot of people will ask me, ER versus inpatient nursing versus cardiac cath lab, you know, what do you love more? I said, it turns out you can love a lot of different things about the same. So I do love what I do. I enjoy it. It's very challenging, but it's not what I thought I would do.
Do you think it'll be difficult for us to get jobs once we're like out of college?
No, I don't. And I say that, and it kind of depends on where you are and what you're doing. But right now there's a shortage of primary care healthcare providers, and that means your regular doctor. If you get an ear infection or the sniffles or a cold or infection, you go to the doctor. That doctor is a general practice family care doctor. there's a big shortage of those types of doctors. A lot of people are specializing these days because the specializations tend to pay more money.
Why aren't there like as many?
To be a general practice doctor, so to be a cardiologist that I work with, you learn everything about the heart and what systems affect the heart. But you don't know a lot about liver, and not that you don't know a lot, but you're not as, you know a lot about one area of the body, but you're not as well versed in all of the other areas of the body. So some people say that family practice doctors have to learn more, it's tough, and it pays less. But there's a big shortage of them. Especially there are areas of the country that are designated underserved areas where people don't have enough mental health services. They don't have enough psychiatrists. They don't have enough doctors who deal with mental health. They don't have enough general practice doctors. They don't have enough gynecologists. Was that labor and delivery? Who wanted labor and delivery? There you go. there isn't, they have to drive a long way. Cardiology, where I work, we have people who drive an hour for care to get a cardiologist care. So especially if you're willing to go somewhere where they're needed, I think it'll be easy to find jobs. Now here locally, right here in this Cedar Falls, Waterloo area, right now we're graduating a lot of nurse practitioners. And the market is a little tough here to get a job. But if you're willing to go a little ways away, then yeah, it's a little easier. What other, yeah.
So you know how for like certain jobs you travel, well not travel a lot, but like for you'll like move somewhere else to get a certain job. Is nursing and like the healthcare field kind of like the same thing?
They can be, yeah. If I'd been willing to move, I could have found, right after graduation, I could have found a labor and delivery job. But my family's here, my husband has a job here, and so that wasn't, I personally was kind of tied to this area, so I found a job that was open, or I could have waited. But, you know, if you want a specific area of healthcare, there are, who's heard of Mayo Clinic? Okay, some people say, I want to work at Mayo. I want that prestige. They're really good. They're a research hospital. I want to be involved in care, but research also. So you go to Mayo, or you look for Johns Hopkins, or you look for a facility that you know does what you want. I like cardiology. Not everywhere, not every hospital has a cath lab. So I can't go get a job at any hospital. I have to find one that has the strength in the area that I'm interested in. Does that make sense? Yeah. So if you wanted to be an engineer, you'd look for a school with a good engineering program. So you might move there, and then you'd find an engineering job where there was an opening. You might have to move again. So with nursing and with the medical field, every town has a hospital, but not every town has a hospital with every specialty. Does that make sense? Okay. In the healthcare field, there's also lab techs. There's also, you know, people who work in the laboratory, and we draw blood and we send it to the lab, and then they give me values that I can't do my job without. Without those lab results, without those lab technicians analyzing the blood and telling me what the potassium is for my patient or what their creatinine is, so I know if they can have contrast during our procedure and still protect their kidneys. I have to have that information. That's absolutely vital. So if you like science and if you like chemistry, maybe you want to work in the lab. It is an absolutely vital role. So there's a lot of, and that's where with job shadowing you get exposure to a little more. There are so many more roles in a hospital than I had any idea.
How old do you have to be to job shadow?
I know we have high schoolers who do it. So in order to job shadow, I don't know what the lower age limit is. I can find out for you. You also have to, we have a law in our country about protecting people's private information. Let's say I took care of your dad, okay? Unless I have your dad's permission, I can't see you a week later and go, hey, how's your dad feeling? Because maybe he didn't want you to know he was in the hospital. Now, I'm just using you as an example. That didn't happen. But you have to sign an agreement that whatever you see, you won't talk about specifically. So if I run into somebody in the hospital, somebody I know, I have to say, can I ask how you're doing afterwards? Otherwise, I shouldn't even act like I know they were in the hospital, because people's private information, we protect that very, very, very seriously. else can I answer? Very, very good questions.
When we did our 4-year plans to prepare for the rest of high school and beyond, one of the classes that our students have the ability to take is the CNA class.
Yes, certified nurse's aide.
Yes, and I think it's a wonderful opportunity. It gives them the chance to work in either a hospital or a doctor's office, wherever, plus earn some money,
Yep.
some decent money. Would you recommend that? That
Yes,
it's
very
because it
much
really
so.
gives you the good exposure and.
So, when I go to the hospital to work, there is no task for myself or physician that is too menial. Do you guys know what menial means? No? So when somebody's sick, a lot of times they're very, very sick, especially if they're in the hospital. They're very sick. They need help with their basic needs. They need help getting to the bathroom. They might not be able to walk and get to the bathroom, so I might have to clean them up. They need help in the shower. They need help getting cleaned up in their bed. They need help breathing. They need help with some of their most basic things. It's not just putting a stethoscope on them and giving them some pills. So as a CNA, a certified nurse's aide, and by the way, when I was in nursing school, I did work at Allen, they're called patient care tech. It's the same thing. It's helping people with those basic needs, getting them what they need, changing their bed, helping them walk. I mean, some people, walking is a huge step in recovery, but some people can't do it on their own. They need help. And so there is a lot of value in starting there, and you get to see a lot. You see a lot of just the inner workings of the hospital, and that's a very, very good way to kind of see if this field is really for you. It's not, there's a phrase, it's not for sissies. It's not for the faint-hearted. There are a lot of awesome, amazing parts of my job, and there are a lot of hard parts too, a lot of very hard parts. And taking that CNA course is a good way to earn money. You make pretty good money doing that, by the way. And it's a very good way to see the inner workings of, I keep saying hospital, we use a lot of CNAs in the hospital, long-term care centers, which are also called nursing homes, that sort of thing, assisted living. You can get jobs there with that certification as well. It's a very good way to see healthcare and see if it's something you're really interested in and see a lot of different things. So yeah, I would highly recommend that class. Okay. Yeah, so having a bachelor's degree, it's a 4-year degree. You learn a lot about the body. You learn a lot about the disease process. We call it pathophysiology. Specific diseases, what they do to the body, and how to either cure them or treat them until end of life. When I was your age, I used to think that there was just too much to know. It was just so vast, nobody could ever know all of it. It's a lot simpler than I thought, but it's very, very complex. And so I love it. I love it. I'm so glad I did it. But I work weekends. Not every weekend, but I work weekends. I work nights sometimes. Sometimes I work on holidays. So my family has to be willing to adjust a little bit. Sometimes I work on Christmas. Sometimes I work on Christmas Eve, 4th of July. So those are things, and my kids know, my littlest one, Sam, he's 9, he goes, I know, there's sick people on the holidays too. he's heard that enough. But that's what I chose. Questions? Yeah.
So going through like med school or different med programs,
Mhm.
I heard that like because you kind of have to be there, and then there's a lot of like labs or like different types of things you have to do while you're doing that.
Mhm.
So is like having kind of like an after school job for that easy or no?
So you're thinking of med school? Okay, so for the first 4 years, you're getting a bachelor's degree. So a lot of science, it's kind of the same as any other 4-year degree. So yeah, you'll have a heavy class load. It'll be hard, but you'll work too, and that'll be okay. And it's a good idea to work in a hospital because you learn so many little things just by overhearing, or somebody will teach you something and you'll say, I took care of a patient like that, and it becomes more real for you. Now, when you get into med school, I haven't gone through med school, but I know it's tough. And it is tough to have a job. But again, if you can have a job in the hospital area,